Let's spend a little time talking about the treatment and the diagnosis. First, the diagnosis and what technology I use to diagnose these. Now again, I just mentioned 6 different types, so some of these kind of vary from type to type. For the purpose of this video, I'm particularly going to be focusing on the most common types, the degenerative type and the isthmic type. That's the stress fracture one, usually seen maybe in someone in high school as repetitive hyperextension, gymnasts, football players, swimmers, tennis players. Also some people who just work out a lot, and then other people just have a genetic predisposition and just get it, and they never played any of those sports in high school. But those are some people that are more likely to get the isthmic hyperextension injury over time type of spondylolisthesis. So what are some of the technologies I use to diagnose it? Well, x-rays are critical, and these are x-rays where I want the patient standing up. Essentially, I want to see what gravity does to the spine. I don't want to see them when they're laying down. I want to see what gravity does to the L4, the L5, the S1. I want to see where their hips are in relation to their spine. You want to get, at minimum, a front view, a side view, a leaning forward view, and a leaning back view. Getting an oblique view, so instead of just being sideways, a little oblique, is a little debated in terms of the clinical utility of those. It definitely has some merit in some, but it's not a critical thing to get. In addition to x-rays, essentially every time a spine surgeon is also going to want and is going to need an MRI of the spine. Now the MRI is different because the MRI shows the nerves, it shows the spinal structures such as the thecal sac, the spinal cord. It shows how much tightness from either thickened tissue or from instability of the bones is being squeezed on that nerve. So an MRI is critical to the diagnosis as well. Additionally, not imperative, but in certain cases, the spine surgeon might order a CT scan. And a CT scan would also show that fracture. It could also show the arthritis of the joint. It could also show some of the underlying pathology I mentioned earlier in the video, but it's not always critically needed. If a patient can't have an MRI, maybe they have severe claustrophobia, maybe they have a pacemaker or some other metal implant that is not MRI compatible, a CT myelogram is another advanced technology I use. It's somewhat uncomfortable. Pretty much they put a needle into the back, you put dye around the spine, around the thecal sac, around the neural elements, and then you get the CT scan, and that's called a CT myelogram. There's also a very narrow subset of patients. I might order something called a SPECT CT. That might be useful in the early diagnosis of a pars fracture. There's also the pathologic variant I talked about earlier, and a SPECT CT sometimes is used in that setting.